back, everybody. Better health, better Kentucky. I'm back once again with our folks here from the Kentucky Health Department Association. I'm joined once again by Andrea Viney. She's the Communications Director Chair. She's also the Health Director for Bourbon County Health Department. I have a very special guest today, Sarah Jo Best. Thank you for reaching us, Sarah. Sarah is the Public Health Director at Lincoln Trail District. She's also the past president of the Kentucky Health Departments Association, and she's also the current Advocacy Committee Chairperson. Sarah, there's a lot of things on your mind. Andrea, it's a pleasure to see you again. Sarah, who are you, what you do, and tell me what we need to talk about today.
All right. Well, I think today we're talking about public health transformation. And one of the things that I would say about that is Kentucky has really stood out nationally for our work in this area. We're considered a leader across the United States in public health transformation and participate in groups to highlight the work that we've been able to accomplish here. Uh, I work with the Kentucky Health Departments Association as a public health director. The Kentucky Health Departments Association, again, represents all 61 local health departments across the Commonwealth of Kentucky. And we've done some pretty unique work to modernize public health delivery and to stabilize our funding so that we can assure that all the Kentuckians across this wonderful Commonwealth have access to minimum packages of services to keep them healthy and well.
Well, I noticed that on the KHDA health website, the transformation's got, it looks like it's got a mission statement, and it's working together for an efficient, sustainable, and accountable public health system focused on producing better health outcomes for all Kentuckians. That looks like it's something that Sarah, that you is it Sarah or Sarah Jo? I want to make sure I'm right on this thing because I've been accused of being not making fun, not making sure I do it.
I'll answer to either, but the people that know me well call me Sarah Joe.
Okay, so not "Hey, you." Okay, so Sarah Jo, I understand that would you say that what I just read is a mission statement for the KHDA's public health transformation?
It's the mission statement for the association overall, and public health transformation was definitely an avenue for us to accomplish that. So, when you talk about a healthier Kentucky and healthier Kentucky producing better health outcomes, that really was part of the foundation for why we needed to do public health transformation. And so, we found ourselves in really a threat that each county across Kentucky may not be served by a local health department because there was a lot of instability in our funding. We said we were a mile wide and an inch deep. We were required to do lots of different services, and all those weren't in statute, and all of those weren't fully funded for us to be able to do. And so, really, there's nothing better to bring a group of people together than a good crisis, and that's where we found ourselves really back in 2014. And the association came together to develop a strategic plan to work through that as an association and to assure that each county across the Commonwealth of Kentucky could maintain a minimum package of services to our constituents in Kentucky and really add viability to those local health departments. And so that work started back in 2014. Um, it did the legislation that became public health transformation and really began moving us and formalizing that process did not pass till 2020. So there was a lot of work that was done before that, but you saw us come out with costing public health. That was one of the things that we needed to see is, we didn't have an infinite amount of resources, right? And so we had to determine what does produce better health outcomes, how much does that cost, and how are we going to pay for it to sustain it. And so that's what we did as an association. And then fast forward to about 2017, and the Kentucky Department for Public Health began working with us a little bit on that too. So a lot of work went into the foundation of that to then pass legislation in 2020. And what that did was basically looked at an equitable delivery of public health services across the Commonwealth. And so we had statutory requirements, and then we had services that we knew were coming up in each of our communities as needed. And so those were called core services. And those were the Women, Infant, Children program. So the WIC supplemental nutrition program that many people are familiar with. Also, our HANDS program, which is a home visitation program that is for healthier pregnancies and healthier raising children, just help for parents with new kiddos. And then also harm reduction services. We had seen by this point that opioid use was a problem in the Commonwealth of Kentucky, and that we needed to get our health departments involved in bringing solutions to that. And so that's where it all began: is what does Kentucky need from its health departments? What is a minimum package of services that can be provided, and how do we fund that in order to assure that no matter where your zip code or location in Kentucky is, that you as a Kentuckian have access to those services?
Sure. I mean, said a lot right there. There's a lot of stuff going on. And I know that you encapsulated maybe 12 years of work into a couple of paragraphs. So let me kind of try to digest this a little bit better and dissect it so that it's a little bit more understandable. It looks like the transformation has got three legs. The first leg is equitable funding, which you just hit on, focus services, which you hit on, and then stabilized pensions for, I guess, the health providers. So before we get into that, you mentioned funding. Nothing can be done without funding, and nothing can be done without goals and opportunities. It's clear that by the hands and the harm and the WIC programs, there's a clear goal and a clear need, and it varies by county.
Mhm.
So my question here is that, do the legislatures who maybe in central Kentucky who don't have the opioid problem or the WIC problem that we face in eastern or western Kentucky, do they really care about funding this program? Are you running into roadblocks with the legislature from a partisan situation? Are they looking at it from a Republican or a Democratic way? Or are they looking at it that, hey, you know what? Regardless of what my political views are, Kentuckians need help for their health, because our health department, the Health Departments Association, said there's a need. We need to act. How hard was that to get done? Was there pushback, or is there are legislatures throughout the entire Commonwealth on board with this? And what was the experience like to try to establish that funding and maintain that funding?
So we had two really strong champions, one in the House that worked on this. We also had a group of legislators that worked on this legislation, bipartisan support. I feel very fortunate to work in public health in the in Kentucky, uh, especially right now, because we do have a lot of support for local public health, and there is a deep understanding. And maybe it's coming from a primarily rural state, but there's a lot of support for local public health and an understanding of the services that we provide. Uh, you know, the funding for it is so critical to us because a lot of what health departments do, or a lot of what public health does, there's not a billable, there's no one to bill for that service, right? When we talk about communicable disease control, and you're looking at contact investigation and identifying the source of the illness and or disease, or whether that's food, water, an index case where people are exposed, you can't bill insurance for that. We're not something that the private side of the healthcare can step up to and take over and assure some of the things that we do. And so I think that there's a deep understanding of that. I do think that Kentucky Health Department Association has been very successful in developing relationships, bipartisan, with our legislature, with our executive branch. So I think there is a very good understanding that the health departments are needed, that what we do has a high return on investment. One of the things we talk about is tuberculosis. Health departments are at the center of identifying whether that's latent TB or active TB in our community. and assuring that that's not transmitted throughout our community and that people receive the services they need to be cured of that. That's a fatal disease.
Sure.
So when we talk about return on investment, health departments treat latent TB. We identify cases of latent TB. What that means is someone's been exposed to tuberculosis, but they're not actively exhibiting symptoms, which means they're not contagious right now. That is a much cheaper point to treat them at that phase than it is the medications. The cost of treatment is much cheaper when it's latent TB prior to
So,
becoming
yeah,
active TB.
it's easier to prevent it than it is to treat it because preventing it is X amount of dollars and once it's done, but treating it means hospitalization. It could mean long-term care. It could mean in-house care. Andrea, how has as communications director, how has this transformation affected your ability to process and do the things that you do for the state?
It's changed it dramatically, like Sarah Jo was talking earlier about, how we used to see ourselves as, a mile wide and an inch deep. We were just doing so much, we just had so much on our plates that we were just not being able to really dig deep into the issues that we truly, as a local health department system, needed to work on. Another kind of word that we use is a do or a sure model. So we want to make sure that the things that we were being tasked to do, if they're already being done in our communities by other providers, is it necessary that the health departments also do that? Because we can then focus on the things that only local health departments are doing. So that's one of the ways this public health transformation model really helped us to define what does local health departments really need to do, because maybe some of these other programs are already being done in our community, so we don't need to duplicate those services, and we can just focus on, like she said, like the communicable disease, the contact tracing, the environmental services, the preparedness pieces of what we're required to do, our health education, like hands, wick, and harm reduction. Those are things that only health departments, either we do by statute or we do because it's this, we've deemed those services so important and no one else is doing them in our community, that we're going to keep doing those. And we mentioned in our last podcast about the local priorities. And so with public health transformation, it still gives us an opportunity to still look at our local communities and see, it may not be those statutes, the programs that are in our statute or those core programs, but we still need to focus sometimes on locally on some things that might be issues individually around our community. So that's what public health transformation has really done for us. It's given us a very focused look of what we really need to do as local health departments to truly make our health status better in our own individual communities.
Sure. Sarah Joe, do you think that the plan that's out there, the plan that you all are working with, do you think that it is being successful? And what's the next step for transformation?
I do think it's being successful, and we've been working with some partner agencies on really tracking that. The unfortunate part about public health is when you're talking about making systemic change or making change across a community and a population at large, that takes time. And so it's a little slower to see some of those outcomes. It's very easy to measure the number of immunizations you've given or, numbers like that. But to truly watch health status and health rankings change, it takes a little bit of time, but we have seen that. We have seen Kentucky improve in the national rankings. We are monitoring that, and we do expect those changes to happen because, like Andrea said, we're more focused in our efforts. So there's more consistency across the Commonwealth and what we're working on. I also think it's provided some relief to the local health departments. You mentioned the pension leg of the stool. That was huge in creating some sustainability for the health departments because before we passed that legislation in 2021, as part of public health transformation, we had to do a pension contribution on a percentage of payroll. And so what you saw across the Commonwealth is the only thing that we could control to cut our cost if we didn't have the money for that is to cut staffing. And so I think that the other difference it's made is when we've been able to acquire more staff so that we have more of an impact, so that we can do those programs better. And that we had one health department that literally only had 8 employees, I think, and couldn't be open on Friday before some of this happened. And so now the availability of public health services through increased staffing is much better than it was prior to public health transformation.
So taking the financial aspect out of it, the two legs about, pension stabilization and equitable funding, take those two out of that, and let's look at the one leg of that, which is increasing, public health awareness. Every goal, every plan has got some sort of metric that they are monitoring. Can you give me a specific pinpoint of something that was done, how that's been affected on a positive basis, and then tell me, or let's talk about what happens next, what goes further, what's the next step of this transformation?
Well, I mentioned one of them, and one of them is that our overall health rating in the American Health Ratings we have gone up. And so we expect that to continue to do better each year. So we've always been in the bottom rung of the rankings, and you're seeing us finally make some impact and we're moving up. So we're doing better in that overall general area. Some of the other things that we measured this year when we were looking at public health transformation is we looked at the return on investment. I mentioned tuberculosis, so we looked at the return on investment in preventing disease and treatment cost, and so that is lower with the health departments focusing in that area. We also looked at immunizations, and we were able to demonstrate that there's a direct correlation with the number of tetanus vaccines that are received across the Commonwealth of Kentucky. If you reduce the dollar amount in public health transformation, you see a direct correlation with the number of tetanus shots administered, and that could be a direct correlation with staffing as well. So we know that we're seeing an increased access to the services that are considered foundational. We know that there has been a positive impact on staffing levels in local health departments, which that's an economic impact too. There's
Absolutely.
3,000 local health department employees across the Commonwealth of Kentucky right now. That number was much lower prior to this happening, and so there's economic significance there in employment. So those are just a few, just right off the top of my head, that I can name. But we're working with other partners to really try to measure that. Another thing that happened in public health transformation is the requirement to do a community health assessment every 5 years. A lot of us were doing that, but there was not a requirement to do that. And so now you have 100% of the health departments working or have completed a community health assessment. Why is that important? Because that helps identify why are people becoming ill in your community? What are the major risks to health and safety? What are the major causes to premature death? What are the gaps in services that Andrea mentioned? Is there a gap in some?
And another measurement there is like in Pike County, we're and in Floyd County, I've noticed, and even in we're making strides, we're making progress because mothers are now getting food and stuff for their children. We're now seeing that there's been more increase of awareness of, oh, I can get a tetanus shot, or oh, I can get my flu shot, or oh, I didn't know that the health department did that, or I didn't know I could do a smoking cessation. And I think that is a wonderful aspect and part of this transformation that you guys have talked about. 25 years ago, when I moved to Kentucky, I don't think the public health department was anywhere near where it is now. When I talk to my health department officials, when I talk to the folks who are on the front on the front lines of this thing. When I talked to Sarah Jo, I just met, and to Andrea, I've been talking to, it's amazing what you guys have done. And people just don't know how hard you're working behind the scenes to help, what metrics and measurements you've done, how much money you've saved the Commonwealth taxpayers because of the things that you're doing. And people say, oh well, they're just hiring more people just to drain the thing. They don't understand that for every person you're hiring, that person can help 8 people not get tuberculosis, or not get into a hospital bed, or not be put on oxygen, or not be a drain on the financial resources. Andrea, I see you waving your hand. Tell me what's on your mind, young lady.
I was just thinking of another matrix that I think has been really positive in our work and our journey over the last several years. Harm reduction is one of the core things that we that falls in our core public health bucket. And we have worked tirelessly on trying to decrease overdose death rates across Kentucky. And I am really happy to say that, not every local health department has a syringe exchange program, but most health departments have some sort of harm reduction. And what I mean by harm reduction is mainly like getting naloxone out into the communities, saturating the communities with naloxone, because we know that is a immediate reversal drug to help people survive overdoses. And if you go back and look at the data, back in we like COVID. Well, during COVID, our overdose rates just skyrocketed. I mean, they were high before COVID, but then during COVID, they were just really, really scary. And then we've just continued to pour resources in to just our harm reduction programs. And I think in 2023 we saw I think it was a 9% decrease on our overdose rates from 22 to 23. And then from 23 to 24, we saw an additional 30% decrease in overdose rates. And this is not just local health department. This is just that community partnership that we come together and work on. But I do think local health departments having that harm reduction work has really significantly helped drive that decrease in overdose rates across Kentucky, along with our other partners who work in that field as well.
Sure. And you mentioned, Andrea and Sarah Jo, you both mentioned one very important thing from both of you. Number one is the amount of employees that you have. Number two, your local partners. You can't do this alone. You haven't been able to. You've developed great employees. You've got fantastic people working for you who are completely ingrained upon the public health for the communities in which they serve. And then you've developed partnerships throughout the regions, or the regions of which these people served, or they were empowered to develop these relationships to help them do this. I think that's a testament of this transformation as well. And I think that's part of the one of the legs that we talked about on the focus services, because I think that's vitally important to make sure that, you can't do it all alone. You've got plenty of resources out there, but getting them together to understand the common goal of KHDA, to say, this is what we're trying to do, and this is how we're saving lives, saving taxpayers money, and building on the better health of every Kentuckian in the state of Kentucky, and their children, their grandparents. I got pulled over not too long ago, and I pulled my I know, don't laugh. I pulled out my license and registration, and in my glove box is my naloxone.
Mhm.
Said to me, goes, "What's that for?" I said, "It's not for me. It's for you, in case I pull up on you and I need to help you."
Yeah.
I
I think one of the things you mentioned, Jeff, that I love is one of the things that the health department is so wonderful at is really being a convener of those community partnerships and a mobilizer toward action. Because we do monitor the health of our community. That's one of the three core functions of public health is really assessment and knowing what's going on. And when we identify those risks or those needs of our community, we're great at convening people and then mobilizing toward action so that we can address it as a community, because the solutions to problems are local. And that's where local health departments can really be that leader or that chief health strategist.
Sure. And that goes back to Andrea and your board allowing people like Andrea to do their job and reach out and get more things. All right, we're getting kind of close to the end here. Sarah Joe, finish the sentence for me. If you had a group full of people, let's say there's 20,000 people in Rupp Arena, you're in the center with a microphone and you said, Kentucky public health transformation in the future looks like this, what would that be?
Healthier Kentuckians. I would say it looks like healthier Kentuckians that elevating everyone to live the best quality of life for the longest quantity that we can possibly do that.
And people don't understand what you just said, how that can help businesses relocate here, how that can help people who want to retire in Kentucky, how that can help the long-term goals that can build population and build commerce and build those things. That is so vitally important. I wish you guys the best of luck. You're doing one hell of a job. I can't tell you how much I appreciate what you're doing. And I hope that the legislature really understands what you're doing. And I hope the governor sees, I know Andy's a Democrat. I don't care anybody's political thing, but he needs to fully understand exactly what you guys are doing so that when he goes to Europe and when he goes to all these places and say, come to Kentucky. Not only do we have great things, beautiful mountains, we've got a public health department and a public health association that's going to make sure that your employees, your families are healthy, they don't get sick, and we're going to fix the problems. And you're never going to have to worry about your health so that your employees, if you come and bring a pen manufacturing company to wherever in Winchester or Pikeville, they know that we are going to provide a safe, healthy environment for them. I can't thank you enough for what you're doing.
Thank you for having us today.
Thank you so much, Jeff.
Thank you, guys. I really appreciate your time. We'll schedule again. Again, thank you, everybody. Better Health, Better Kentucky. Go to the Kentucky Health Department Association for more information. Go to their website, KentuckyHealthDepartmentAssociation.com. You'll see a plethora of information. You'll even see the Public Health Transformation Program on there that Sarah Joe, my new best buddy, Sarah Joe, just put together. And it's very enlightening. It's very informative. And, you know, in the hours between 2 and 3 o'clock in the morning, when you have nothing better to do, that you take time to put this together for the state while you're also helping, the Lincoln Trail District is an amazing feat. Thank you, ladies, for what you do. I appreciate you so much.
Thank you.
Thank you so much.